Today, for our last episode of 2024, we wanted to do something a little different. On December 3rd, the Bloomberg American Health Initiative held its annual summit. It's sort of a state of the union for public health, and this year the theme really marked the moment: advancing public health in uncertain political times. The day made clear that through all sorts of political weather, it's through evidence-based tactics and strategies, combined with indefatigable passion and dedication, that public health work gets done. In today's episode, you'll hear 3 conversations from the summit about how public health and government can work together to solve complex problems. First, how public health data and evidence provide context for judicial decisions. Then, how a public health lens is helping to address the issue of gun violence. And finally, how to find common ground across policies and politics. You can watch the full event, which includes speeches from public health superstars like Michael Bloomberg, Cory Booker, Lucy McBath, and Marian Nessel, and on-stage panel sessions moderated by health journalists at the link in the show notes. I'm Lindsay Smith Rogers. Let's listen. Public health expertise and context can be vital assets to government work. For example, in the judicial system, experts unaffiliated with a court case can submit amicus briefs, which can provide historical context or technical assistance. But a new tool can help evaluate decisions after they're made. Hopkins Judicial Health Notes, developed by researchers from the Bloomberg School, reviews court cases and decisions to determine the health and equity consequences of legal actions. In an onstage interview, Madeline Davis, a senior editor at The Examination, talked to Keisha Pollock-Porter, Bloomberg Centennial Chair of the Department of Health Policy and Management, about Hopkins Judicial Health Notes. Let's listen.
Professor Keisha Pollock-Porter is going to share details on the Judicial Health Notes project for the very first time today. It's just launched. It's hot off the press, as us journalists like to say. So, Professor Pollock-Porter, could you tell us what problem you're trying to fix here?
Yeah, first of all, thanks, Madeline. We are thrilled to release the Judicial Health Notes today. And the problem we are trying to solve is that every single day, decisions are made in sectors outside of health, such as transportation, energy, housing, and health impacts aren't always at the forefront. So my colleague Stephanie Kerrigan and I and some other colleagues created a tool a few years ago called the Legislative Health Note to focus on proposed bills. And we saw an opportunity to also highlight court decisions. And so that's the problem we're trying to solve.
And could you talk me through one key example of a judicial health note?
Yeah, so today we released 3 health notes that we've been working on for the last several months, and one of them relates to a case that some of you may have heard about, and it's called Grants Pass v. Johnson. And so this is the case that the Supreme Court, the U.S. Supreme Court this summer, basically ruled that it is permissible to remove homeless individuals from encampments even when there's no place for them to go. And so basically what we did is we saw that the discourse around this case didn't involve public health or equity in a way that we thought needed to happen. So we conducted an analysis, we pulled together data, and we pulled together some literature, and we showed the impacts for individuals who are forcefully moved. We saw how their access to treatment and healthcare could be disrupted. We also saw that there were challenges for individuals where actually instead of reducing or making it safer, it actually increased interactions with law enforcement. And we saw impacts on people actually having fines or more interactions with police that could actually make it harder to get homes in the future or secure a job.
Mm-hmm. And what impact are you hoping these judicial health notes will have?
We hope that we will be able to highlight the potential health impacts, particularly when health is not always at the table. And I want to acknowledge all of my colleagues, including myself, who oftentimes submit amicus briefs to highlight the potential health impacts and try to influence a judge's decision. But what we want to do is say, well, after a decision is made by a judge and somebody has to do something to comply with the law, during implementation, how do we think about health and equity? And that's our focus. So what I hope and my vision is that people are calling us, that they want technical assistance, and that they're looking at how to use this tool to bring health to the table when health is not being focused on.
And did it shock you that judges weren't taking public health considerations into these decisions?
Not at all, not at all. And I think everybody's laughing here. I mean, I'm sure you're not surprised as well. So much of this work is part of what we've been moving forward, which is called Health in All Policies, and really thinking through how can we be intentional about bringing health to the table in a number of decisions. And so we weren't surprised, and that's why we created this tool, and we believe there's great potential to highlight how we can bring health to the table when health is not being discussed in a way that we think is grounded in evidence and doesn't take into account all of the things we know about how to improve health and to reduce harms.
And I found this incredibly inspiring when I learned about it. Could you talk me through some other examples of judicial health notes? I think the audience would be really interested in hearing about them.
Yeah, we looked at another case that relates to the environmental challenges focus area of the Bloomberg American Health Initiative. And this one relates to a case out in Utah where basically there's a big lake that's drying up. And you might think, well, of course there are health impacts there, but this particular case, when you looked at the court decision, and it's actually the courts are in the process, the judges in the process of deciding this decision, we wanted to highlight all of the ways that the drying of this lake could impact health. And so we pulled together the evidence, and we saw impacts on respiratory illnesses. We saw equity impacts in terms of the people who live close to this area. We saw potential for toxins to be carried from the dry beds in the land, and this really was important. And we hope that individuals and advocates and other organizations will take our findings and help to really think through how we can reverse some of these impacts, how we have the evidence to say, let's look and see how we can actually slow down the degradation of this water source that's so critical for Utah.
Mm-hmm. And we've got 30 seconds left. I think we've got a QR code to bring up. Professor Pollack-Porter, what's the vision for the project going forward?
Well, first of all, take out your phones, scan the QR code, and we hope, my colleague Stephanie and I and our whole team at the Johns Hopkins Bloomberg School of Public Health, hope people reach out, contact us to learn more about the judicial health notes, check out the ones that we have posted online, and please contact us and promote health in all policies through this new tool.
Thank you so much. So inspiring and exciting.
Thank you. Thank you so much. Thank you.
Gun violence is one of the top killers of adults and children in the U.S., and in the past has seemed like an intractable problem. Applying a public health lens to this complex and critical issue has yielded actionable change. In this interview, Riley Griffin, a healthcare reporter for Bloomberg News, talks with Rob Wilcox and Greg Jackson, deputy directors for the White House Office of Gun Violence Prevention. Let's listen.
Please welcome back Riley Griffin alongside the deputy directors of the White House Office of Gun Violence Prevention, Greg Jackson and Rob Wilcox.
Greg and Rob, we are going to be diving into some policy discussion moving forward, but I want to start with your personal stories. I wonder if you could tell the audience here a little bit about how you actually came to this line of work and how it's informed the way you think about gun violence through the lens of public health. Greg, we'll start with you.
Yeah, it was a pleasure to be here. And unfortunately for me, my start to this work wasn't through ambition or application. It was through tragedy. In April of 2013, I was caught in a shooting and was shot, and the bullet that hit me hit 2 arteries. And I came within 26 minutes of losing my life. And I'll never forget coming out of one of 6 surgeries in my 6-month recovery, but really that first surgery, and turning on the news and watching leaders in Washington refuse to take action because I was shot just 3 days after the failed Senate vote on universal background checks in the wake of Sandy Hook. And so that's where that fire really started to burn with me about how do we change things and how do we push Washington to do more on this issue.
And Rob, your story?
Yeah, so my cousin was shot and killed in January of 2001, making me like 54% of American adults who know someone in their family or friendship circle who's been affected by gun violence. She was on winter break from Haverford, volunteering at a local hospital when someone walked in with a gun who shouldn't have had it. I moved to DC to start taking action right out of college, and I was welcomed with a headline that said, with the election of George W. Bush, the NRA would work out of the West Wing. And if you think about progress, and I think about what we're here for, within 20 years, instead of the NRA working out of the West Wing, you had 2 gun violence survivors, 2 gun policy experts, leading the first ever White House Office of Gun Violence Prevention.
What a testament to your leadership. It's a novel office. We're just a little bit over a year into the office being formed. And I know you've put out a progress report. I wonder if you could tell me briefly what one key accomplishment you've gotten in the last year is that you outlined in that report, Greg.
Want to kick it off?
There you go.
Well, look, I think the big thing is that we ushered in the first ever public health approach to the issue of gun violence.
Yeah.
I know when I was shot, when I arrived at the hospital, I was met with investigators and law enforcement before I was met with doctors and surgeons. And in America, that's how we've looked at this issue, as a crime to solve and not a public health crisis to prevent. But we started to shift that, and whether it was the first advisory from the U.S. Surgeon General naming this a public health crisis, whether it's President Biden, the first president in history to name this as a public health crisis on December 21st of 2020, but more importantly, the interagency approach that we were able to build. We had 12 different agencies that played a role in addressing this crisis, over 54 executive actions, $30 billion in additional funds to prevent violence, and passing the first law on gun violence in 30 years. And so that all has greatly informed and impacted how we've attacked this issue. I do want to pass it to Rob, though, to share a few specifics.
Yeah, look, I think the biggest thing we did is we went from solving yesterday's crime to addressing today's public health crisis. And you do that by actually motivating folks outside of just justice and law enforcement. So we focused on the Department of Labor and their youth summer employment grants. We focused on pivoting the grant programs to help remove guns from domestic abusers. We focused on getting more data on gun violence. And we focused on the industry, honestly, who's been profiting to a tune larger than Nike on guns. And what we focused on were the bad actors. And so we shut down more gun stores, rogue gun dealers the past 2 years than the past 20 combined. And that's how we make progress, is we actually go at the problem.
Rob, this room knows how to follow the data, so I'm glad you mentioned data. For the public health community, they've often lacked the ability to have transparent access to data on gun violence around this country and those who are living with injuries. I know the federal government has access to some of that data behind the scenes, but what's it going to take to bring that to the public eye?
Look, you all are so important to this crisis because we're going to leave these seats in 50 days, but your efforts are going to continue. So one of the things we focused on from the very beginning was getting you better data, because we know we need to know where people are getting shot, injured, and killed, timely and local, so we can both implement solutions and measure progress. So what did we do when we started? Greg and I went to HHS. We said, you built a system to figure out when somebody sneezed across this country.
Right.
You telling me you can't tell me when someone got shot?
Right.
And so what they've done is use the hospital data systems, the same ones that were built for COVID, and filled those canals with gun violence data. So we do now have hospitalization data on gun injuries that has a 1-month lag down to the census tract. We have death data that has a 3-month lag down to the local level as well. And that actually gives us the first ever national picture on gun death and injury, so we can focus and target our solutions.
And I just want to reinforce, there's some really big findings in there. You know, we found that gun violence is the #1 cause of newly disabled Americans. It's a top 3 cause of death for pregnant women in America. We talk about how this is the #1 cause of death for youth. Only 1% of that happens in schools, right? So we're starting to see the full picture of what this crisis is. And we know that data can really empower you, as all of you are part of this movement, whether you signed up or not. But now you can start to see, okay, well, if this is the challenge in my community, like Intermountain Health, for example, where they're looking at, okay, how do we creatively get to older rural men that we are seeing surging in suicide? But with that data, we can empower this broader movement to think of new and innovative ways to solve this crisis.
And I think on the data, if I could just say, one thing in a limited time we have to tell you is that the solutions we put in place the past 4 years, we've seen success. And it's hard to measure success with an issue as painful as this, but last year we saw the greatest, steepest decline in gun and homicides in the nation's history, 13%. Which is amazing.
Yeah.
This year, it's 17%. City like Philadelphia saw a 50% reduction. City like Baltimore, over 40% due to the partnership of local state government, LifeBridge health system, Safe Streets, right? These solutions we know work. And the question we're confronted with, are we going to double down on them, even without this office, or are we going to walk away?
Well, you've hinted at the elephant in the room, which is what becomes of this office in the next administration. And it might not be something that you can necessarily answer to, but I wonder how you'd like to see the torch carried.
You know, look, The previous administration was very clear that they did nothing on this issue. They even bragged about it. And we know that this is not a topic or a debate. This is literally our family, our cousins, our friends. It was almost my own life. Last fall, I lost my mentee to gun violence. Someone who actually came to Capitol Hill and fought for the Bipartisan Safer Communities Act was shot and killed in his front porch. So we can't expect them to carry the ball forward because they've already set their agenda. But what we're inspired by is all the work that we've laid out. Those 54 executive actions are a big deal. Now that Medicaid can be used for violence intervention programs and safe storage, adding $2 billion to the Victims of Crime Act, victim services, putting $400 million into community violence intervention, hosting the first ever convening of 60 health CEOs from across the country. Those are all, you can read them all in our report, but those are highlights of the critical work that we've done, and that work will continue to ripple as long as we have people to carry the baton.
And let me be very specific. We didn't offer a prescription on this issue. What we offered was a playbook. And we don't need the federal government to run those plays. Our state leaders, our local leaders, our health systems, our schools, all of us, our philanthropists can run those plays. And so we've published it all, and we just know that we need to get this playbook in action because that's what can save lives.
A final question for you, Rob. Given your work on the Bipartisan Safer Communities Act, what is the lasting legacy of that beyond what the White House is able to do now that we have this legislation in place?
Yeah, look, that was the first law to pass in 30 years. Time and time again, we failed to pass federal legislation. But what was the difference this time? Was it more Democrats? No. There was 50 Democrats in 2000, 50 Democrats in 2012, 50 Democrats in 2022. The difference was 15 Republicans joined with us to vote for gun safety because we have changed this issue. We have changed the politics of it. We've changed the policies of it. And so that law both set new standards for gun sales, closed the gun show loophole, addressed dangerous boyfriends who are convicted of domestic abuse, funded $15 billion. And when it was written, those $15 billion don't need to be appropriated. They already were. So we can keep investing them the next 2 years. And it's not just us talking about this law. Last week, the 3 leading Republicans who negotiated wrote an op-ed that said the Bipartisan Safer Communities Act gives us cause for optimism. So I hope that gives you cause for optimism as well.
We'll leave on a note of optimism then. Thank you so much, Greg and Rob, for your moving story. Appreciate it.
For our last segment, how do we find common ground on the issues that divide us? This next clip features a conversation between Public Health on Call co-host Dr. Josh Sharfstein and Congressman Brian Fitzpatrick from Pennsylvania on how public health work gets done across the aisle and how it starts with seeing problems the same way. Let's listen.
Thank you so much, Congressman Fitzpatrick, for being here. You have taken a very interesting path to Congress. You not only served as an FBI special agent and federal prosecutor, but you also are an EMT. You're a Republican, but you co-chair the bipartisan caucus around mental health and substance use disorder. One of our themes today is how we find common ground on issues that divide us.
Yep.
Talk to me.
Okay, where do I begin? How do we find common ground? Well, to start on health, I think the big challenge that we have, particularly with mental health, which is the most underdiagnosed, underrecognized, undertreated, underfunded health crisis we have in this country, that we have to start with the stigma that exists, and it's a very real thing when we address, and we see it all the time in Congress, when we see healthcare addressed, more often than not, it's focused on the neck down and it's stigmatized from the neck up. And I think the key to that is parity. So we have legislation starting in the grade schools, in the elementary school level. It's called the Mental Health Excellence in Schools Act, which basically says if you have an RN in a school, you also need to have a school psychologist, and just creating parity across the board. Kids in particular have a very, very tough time dealing with a lot of the challenges they face in school with the bullying and the social media, shaming and things like that. And it's really, really important that I think we destigmatize mental health and then also make it much more of a normal thing for kids to seek out, because so many of our problems can be nipped in the bud if we address it at the elementary school level.
Great, and sounds like that message you feel resonates
Very
people,
much.
even if they're coming from
Yep.
different kinds of backgrounds. Let me ask you this. There are enormous divides in health across race and ethnicity, between rural and urban areas, and others. How do you see the role of the federal government in making America more fair and just?
Parity. I had a very profound experience. My first cycle in Congress was 115th. I represent just north of Philadelphia, Dwight Evans, my friend and colleague, represents the city of Philadelphia, and there's an amazing eye institute. It's called Wills Eye Hospital, and they had one day a year where they shut down the center, and it's called the Give Kids Sight program, where they brought in, free of charge, any kid with their parents or guardians that wanted to come in and get eyesight examinations, and I think 35% of the kids that left there left with corrective lenses, which is really remarkable because when you think about it, if you can't see, you can't read. If you can't read, you can't learn. If you can't learn, you can't graduate. And it makes it's a ripple effect. And this one, getting at this one root cause issue on one day out of the year for all these kids, just giving them the ability to see and therefore learn was so important.
It is really important. In fact, Johns Hopkins has a major partnership with the Baltimore City schools to make sure that all the kids have access to glasses. And it was interesting because it rolled out in a way that you could study which the schools that got it first versus the schools that didn't. And that intervention alone was almost as impactful on educational success as tutors.
100%.
It was just hugely impactful, which gets to the question of data. One of the things that makes us a little anxious in the field of public health is that people sometimes seem to be showing up with their own data. And not just that they're showing up with their own data, but that data can seem to be coming from, planet Neptune sometimes. How do you think of this challenge of getting people together to talk about the problem and seeing it the same way? Even if they have different views on what to do, at least see the problem the same way. How do you think about that?
I mean, it's where do you begin? I mean, you can't start a conversation when you can't agree the sky's blue, right? There are certain fundamentals that we have to agree on to even sit down at the table together. How we've gotten to a point where data and science is questioned is beyond me. I think technology and social media have a large role to play in that. Way back before any of these technologies existed, if you had some oddball view, you were sort of on your own. Now you can go online and find an entire community of people that share that belief and cause you to act out. That's some of the challenges we've seen. But we just got to get back to the basics. I think that's the bottom line. Belief in science, belief in data is the only way we're going to solve not just the public health crisis, but world peace, literally.
Yeah.
Because a lot of it comes down to data.
I understand that you've been supportive of more resources for key data collection on different kinds of issues. I think we all appreciate that. I think without data, it's really hard to know what's working, and public health is firmly rooted in that. So as someone who is trying the word bipartisan doesn't appear in many places, but you are also part of the bipartisan problem solvers.
Co-chair.
Yeah. And we want problems to be solved. That's pretty much the essence of public health. We have problems, we want them to be solved. What advice do you have for 500 people working around the country trying to solve problems, trying to figure out how to make sense of this moment?
So our group, as many of you know, there's a continuum of caucuses in Congress. So on the far right, you have the Freedom Caucus. On the far left, you have what's become known as the Squad. And then there's a number of caucuses in between. There's only one, unfortunately, but it's our group that's bipartisan. It's the Problem Solvers Caucus. In fact, it's a Noah's Ark rule. If you want to join, you have to find someone from the opposite party to join with you. Every bill we advance is a two-party solution. We sit together in the center of the chamber during the State of the Union address. We go to each other's districts. We call them district swaps. And basically, the message we advance is that we ought to take the same approach to government that we take towards our personal relationships, that you don't allow the perfect to be the enemy of the good. You take 80% of something rather than 100% of nothing. You try to see the world through the other person's eyes, because every single one of us, based on our upbringing, where we went to school, the family situation we grew up in, pain we may have experienced in our lives that other people haven't, it all affects the paradigm and how we approach problems. We follow the same model, by the way, in the FBI. Anytime we had a time-sensitive crime problem, we always use a kidnapping example because it's the most time-sensitive. Every second that ticks off that clock is another opportunity for the kidnapper to cross state lines, at which point the probability of successful outcome drops exponentially. We would surround the table with people from completely different backgrounds, and we actively sought people identifying our blind spots, because we all have blind spots. It's a part of human nature. And secure individuals actively seek people to identify their blind spots for them. So the problem solvers is essentially the legislative version of that. We don't get a whole lot of attention because we don't fight and argue with each other. Unfortunately, that is what gets the attention. We're people that respect each other as human beings. We're friends. We get to know each other's families. Okay. And we actively want to learn from their perspectives because of their different life experiences.
You have our attention. Thank you so much for doing that and for that work and for joining us today at the Bloomberg American Health Summit.
Thank you. Thank you.
We hope this episode leaves you feeling grounded and maybe even a bit uplifted. Remember, you can watch the full event at the link in the show notes. I'm Lindsay Smith Rogers. Thank you so much for listening, and we will see you in 2025.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith Rogers, Stephanie Desmond, and Grace Fernandez-Ciceri. Audio production by J.B. Arbogast, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production management by Catherine Ricardo. Social media run by Grace Fernandez-Ciceri. Analytics by Eliza Rosen. If you have questions or ideas for us, please send us an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.